Hey guys, I'm going to talk about a couple of topics today because I was supposed to talk about something else last week and I totally messed up. So my video last week was different than the topic I was supposed to talk about, so it may end up being a two-part video. See how much I can talk about in 10 minutes. But anyway, the first topic I'm going to talk about is the decision to leave college or work to seek treatment and what options are available. This was a huge issue for me because I'm a professional, I'm a midwife, and I had a pretty decent sized practice when I started recovery. And so had I decided to go inpatient, that would have meant I would have had to take this clientele who expected me to attend their births and had hired me to specifically attend their births and do all their prenatal care, and find a backup plan, which would have meant finding another midwife, and it would have been really difficult for my clients because, clients love their midwives. They picked me because they wanted me at their birth, and so for me to say, oh, sorry, I'm suddenly going to be gone, it would have been really difficult, and I think on some level unfair to them, although the reality is I was bad enough that had I not been able to get control of things, that's what I would have had to do, fair or not, because my life was more important, and if I couldn't maintain my life, then I wasn't doing any good for my clients. So that was a difficult place to be, but in depending on your situation, there's some employers are extremely understanding and will help with treatment, will even help pay for treatment. I've talked to people that their employer actually helped pay for their inpatient care, but in today's economy, that's probably less likely to happen. And if you tell your boss, yeah, I need to get treatment and I might be gone for 4 to 6 months, you're risking your job. And on top of that, insurance, inpatient care is extremely expensive. Outpatient care is expensive, but if you need treatment, you need treatment. And if you can afford it, you get it. And if you can't afford it, somehow you've got to find a way to get it, especially if your eating disorder is that out of control. But unfortunately, we don't have mental health parity. Eating disorders are hard to treat, and it's hard to get insurance companies to want to treat them adequately so that people get the proper treatment and enough time for treatment, because 2 weeks in a treatment center is not sufficient most of the time to effectively help somebody that needs to be in inpatient care. It's barely enough time to medically moderate somebody and do an assessment to see where somebody is, and then and for that person to adjust to the environment and to really start getting used to things and working on things. So it's a difficult decision, and if you're in college, if you're on a scholarship, or if you're in a program that requires you to be on a set schedule, for example, I'm healthy now, so this wouldn't apply to me now. I'm in a master's program, and with my master's degree, I have to take, I'm on a track. I have to take certain classes, certain semesters, and I have to do practicum hours, and it's just, that's how it is. And so if I had to leave for treatment, then that would jeopardize my placement in the program. And I would have to work that out with the program people, because if I missed a whole semester, then suddenly, the whole program's screwed up. So, how do you manage that? That's difficult. But, unfortunately, when I started treatment, I live right by Center for Change. It's a treatment center that has a lot of credibility, and it's really, I'm in Utah, and now it's really one of the only treatment centers, especially for adult women. I I know that there is one in southern Utah, but it's fairly small, and there was one up in Salt Lake, but unfortunately it closed a year or two ago. So for adequate treatment, Center for Change is really the only place in Utah for people that are in need of inpatient care, and they do a lot of outpatient care as well. Fortunately for me, I live about a mile from the center, so I have access to very qualified therapists and dietitians and a treatment team that a lot of people in other areas don't have. So I was able to do a lot of it outpatient, but if you don't have the right support, you don't have the people that are trained, that can be difficult because eating disorders are so complex that you really need people who are specialists. My eating disorder got worse with the therapist that I was working with for a time because he didn't know how to treat eating disorders, and all he did was feed it and feed into the shame and did a lot of blaming, and it wasn't effective. He didn't know how to treat eating disorders. He was good at treating other things. He's not a terrible therapist, but for eating disorders, he was the wrong therapist. So if you don't have somebody that's qualified, then that's something to consider. If you are in college, hopefully most college campuses have somebody that's in their student health services or somewhere that is knowledgeable about eating disorders, because college campuses, eating disorders are rampant. So it's really something that every college campus needs. I don't know what the availability is for every college. I know at the University of Utah, where I attend, we have great resources. We have a lot of people doing wonderful research. We have a good student support program. We have a lot of groups up there. We have Women's Resource Center. So if you are in college, hopefully your campus has some outlet like that. If they don't, you could always approach the student services and say, hey, I have this problem. I know this is a problem for other people and I need support, and how can I work with you to get this in the college? And a lot of colleges, they like the students coming up with new programs, and so it might be an option. But if you don't have somebody that's qualified that's near you, you may have to go somewhere else for treatment. You may have to go inpatient for treatment because you don't have the qualified help that you need. And the bottom line is, if you have the support and you are able to do outpatient care and get better, I think that's optimal, because the reality is you're going to have to live with recovery in the real world, in the outside world. And sometimes when you are put in an inpatient facility, you suddenly create this environment where you're separate from the world and you're protected and you're structured. And a lot of places try and do a step-down program where you go to like residential, and then if they have a day treatment, maybe intensive outpatient, and then hopefully continued therapy. But the reality is that doesn't always happen. And it takes, I think, years of checking in and follow-up therapy to really make sure that you're staying on track. And for most people, I mean, literally years, not just a few months after you're released from outpatient care. And a lot of people don't follow through with that, and so a lot of people end up relapsing and end up back in the same place. And, and so it's really difficult. It's a difficult decision. But the bottom line is your life, if you have a life-threatening illness, an eating disorder is life-threatening. It has the highest mortality rate among mental illness, and you need to find a way to get the treatment you need. And so if that means that you have to quit college, you have to quit your job, their life will continue, and it's not the end of the world if that's what you have to do to get better. Life has a way of presenting new opportunities, and as you change, you'll have new opportunities come up. Even if you have to quit that job, it's not a dead-end road. Neither is quitting college if that's what you absolutely have to do. I didn't have to do that. I almost did, but I was able to work with people in an environment that I didn't have to, and I feel like I was really blessed and lucky for that. So, but the bottom line is get the help you need. Keep asking, and until you get the help you need. Have a good night. I'm going to make a second video.